All right, everyone, are we ready to get this thing started? Yeah! Are we ready to get ICE out of our hospital? Yeah! Are we ready to get ICE out of the state of Minnesota?
Yeah, fuck ICE!
I want to thank you all for coming out today on this cold, cold day. My name is Zach. I'm a resident doctor and a proud union member of CIR. I want to thank you for coming out to support the people in our community who have been affected by ICE. I want to thank you for coming out here to demand that ICE gets out of our hospitals and gets the hell out of the state of Minnesota. Hospital workers across this city have seen the damage that ICE has inflicted on this community. They are in our hospitals. They are interfering with patient care. Patients are afraid to go to their primary care appointments because of ICE. They are going without medication. There are pregnancies that are risky where women are going into labor at home alone because of ICE. This is an entirely preventable public health crisis that is caused by ICE. In order to fix this, we have to work together. Our leaders have to work together. We need our elected officials, hospital administrators, business leaders from across the state to work together, to communicate, to collaborate, to rid our community of this disease. Today, we are exercising our power, our union power. And we are coming together with people across the state and the labor movement to demand an end to this nightmare. Our first speaker today is Ava, who is a physician in Minneapolis. Ava. Everyone give it up for Ava.
Hey everybody, my name's Avalon. I am a resident physician in Minnesota, and I'm proudly here today to announce that we demand that ICE leave Minnesota and leave our hospitals. ICE's occupation of Minnesota has created unsustainable working conditions for doctors and healthcare workers alike. Our patients are terrified to come into our clinics and to come into our hospitals. They are not getting their medications. They are not getting their treatments. And what's worse is when they're here, they're seeing patients detained and shackled to their beds. ICE is invading our daycares, our sacred places of home, of our hospitals, our gathering spaces. They must leave Minnesota. They're destroying our community.
Yes. Get out.
I want to share that I am a native Minnesotan. I grew up in Minneapolis, and the running joke at my medical school was I was that Minnesota girl because I was going to come home and practice medicine here. I love Minnesota, and it is breaking my heart to see us terrorized by ICE. Their brutality is unmatched, and I cannot stand to witness my patients being violently brutalized by ICE on the streets and outside of our hospitals. We demand that ICE leave Minnesota and leave every hospital here for the safety of our community and our patients. We are here to stand in solidarity today, harkening back to the Union state that is Minnesota, back to the general strike of 1934 and to the murder of We know how to organize in Minnesota, and we are here to do just that. We demand that ICE leaves immediately, and we demand for the abolition of ICE.
Thank you, Ava. Our next speaker is Kelly from AFTRI 2474.
My name is Kelly. I'm a physical therapist in the outpatient CSB building. As Minnesotans, we know what real ICE can do. It shuts down streets and puts lives at risk. But the most dangerous ICE in our state isn't on the roads. It's in our hospitals, and it does not belong here. Hospitals exist to heal, not to terrorize. ICE's presence at HCMC has nothing to do with safety and everything to do with fear and intimidation.
That's right.
It shatters trust, traumatizes families, and forces healthcare workers into moral crises no one should face. Medical professionals are sworn to care for patients, not to act as extensions of an enforcement agency built on cruelty and harm. When people fear arrest instead of care, they stop coming to hospitals. That endangers everyone. This fear doesn't stop at undocumented patients. It spreads to citizens, families, and the workers who keep our healthcare system alive. What's happening in Minnesota is national strategy that tears families apart and weakens public health. Immigrants are not outsiders. They are the backbone of Minnesota's workforce economy. They are our neighbors, our co-workers, our loved ones. All of our patients deserve dignity, safety, and health care. Full stop. Hennepin Healthcare is a safety net held together by workers carrying impossible loads in a broken system. Increasing ICE activity in our cities and inside our hospitals creates workplace conditions that are unsafe and unsustainable. Let's be absolutely clear. ICE does not belong in the hospitals. Federal resources should be used to heal communities, not to terrorize them.
That's right.
This is a line we must draw together. Protect your patients, protect your neighbors, protect each other. Stand up, stand united, and demand that ICE get the hell out of our hospital and our communities.
All right, next up we have Santiago from our Minnesota Newspaper and Communications Guild. Santiago.
My name's Santiago. I'm a Spanish interpreter. I've been here at Hennepin for close to 30 years. You know,
Hold the trigger.
as interpreters, we work with words, and so the vocabulary word for today is impunity. So impunity means that you're able to be exempt from punishment or freedom from negative consequences for your actions, allowing wrongdoing to occur without penalty. And so ICE right now is profiling people based on their accent or on the color of their skin with impunity. They're committing acts of violence, aggression, and forced disappearance, and murdering our Minnesota neighbors with impunity. And now they're sitting in patient rooms in our hospital with impunity. Many of us came here to Minnesota to get away from these type of actions, pursuing what Victor Jara sang about, el derecho de vivir en paz, the right to live in peace. So we are here today, together, standing together to resist. To stand with our neighbors and our patients against impunity.
That's right.
And to stand for el derecho de vivir en paz. Say it with me. ICE out of HCMC.
ICE out of HCMC!
ICE out of Minnesota.
ICE out of Minnesota!
Free Nakima.
Free Nakima!
Justice for Renee Good.
Justice for Renee Good!
Thank you.
Thank you. Thank you, Santiago. We have one more speaker today, Abhishek, also a resident doctor here.
Hey everybody, my name is Abhishek. I'm a resident at Hennepin. I'm a resident physician at Hennepin and a first-generation immigrant. last year, residents and fellows at Hennepin decided to unionize because we were sick of the status quo. We wanted a better way to advocate for both ourselves and our patients. It's never been more important for us to use our union power. We've been working around the clock to take care of our patients, and ICE has directly impacted our ability to do that. 2 days ago, I had to look out the window of my clinic and watch 2 people get detained immediately outside of our clinic. We've been carpooling to and from work because we don't feel safe. To say that this is a public health crisis is an understatement. Today we stand together with workers across the state demanding that ICE get out of our city and out of our hospitals. Together we can fight for a tomorrow that we all can believe in. I'll say it one more time. We need an ICE-free workplace and an ICE-free city now.
As healthcare workers and union members, we cannot allow another life to be taken. We cannot allow more families to be separated. We need justice for Renee Good. We need ICE out of Hennepin Hospital. We need ICE out of the University of Minnesota. And we need ICE out of the state of Minnesota. When we fight, we win. Say it with me. When we fight,
We win!
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 All right, thank you all for coming out today. Let's go get warm.